Monkeypox, this cluster in Chicago, what's the data showing? How concerned are you?
Well, I don't think the number of cases is what's concerning, Marni. It's the fact that they're all clustered in the same area. We reached our peak of monkeypox cases last year in August, seeing almost 500 cases per day. Throughout the fall and winter, those numbers have dwindled down. So now we're only seeing maybe 1 to 2 cases per day. So again, 13 cases over the course of 3 weeks isn't concerning, but the fact that they're all in the same area makes you wonder, is this the tip of the iceberg and there's a larger outbreak that we haven't yet discovered? Or are we actively witnessing a resurgence in cases?
All right, so we're looking at some images. What are the symptoms of monkeypox?
Well, the biggest one is the rash. The rash can look like blisters, pimples, or even scabbed over lesions. But patients with mpox also have flu-like symptoms, so fevers, chills, headache, muscle aches and pains. You can also get the rash in very particular areas, such as the genitals, in your anal area, and inside of your mouth that can make eating and drinking very difficult.
Why are we saying mpox now and not monkeypox? What's the distinction?
Well, monkeypox is a mouthful, so shortening it makes it simpler to say. And I do think that there were also some qualms with the designation of saying monkeypox when the only animal that transmits this disease isn't just monkeys and primates. They can also be transmitted from rodents.
Okay, and how do humans transmit it, and how contagious is it?
Typically from prolonged close contact, which is why we hear a lot about sexual transmission if you are engaging in sexual activities with someone who has monkeypox or has been exposed. But it can also be spread in other ways. So if you are touching the clothing or the linen of someone who's had mpox, you can potentially expose yourself. Even respiratory droplets, if there's prolonged contact with someone who has mpox, you can be exposed that way.
And what's the treatment?
Honestly, there aren't really great treatments right now. What we do is mostly supportive care. So if you're dehydrated, we'll give you fluids. If you're having significant pain, we can treat your pain. There is a vaccine for mpox that can be given to those who are at high risk of contracting the disease, but also can be given if you've been exposed or have a presumed exposure that can help prevent or lessen symptoms.
Okay, I want to get your thoughts on this one. Lots of people talking about it this morning. One of the easiest ways for so many of us to cut calories is to cut out our sugar, but artificial sweeteners are now under the microscope, or at least the substitutes. The World Health Organization sounding the alarm on sugar substitutes like aspartame and sucrin, sucralose, stevia even, which is considered a natural one. The global health body suggesting not only do they not help with weight loss, but they actually might be harmful for our health and lead to things like diabetes. What's your messaging on this? Because I think for a lot of people, it seemed like a good alternative, is it not?
You know, Marni, this is a little bit of a complicated answer. It is a good alternative because it's better than natural sugar. We know that natural sugar poses high risk for significant cardiovascular diseases, heart attacks, strokes, diabetes, hypertension. But everything in moderation. When you are ongoing a wellness or a lifestyle change or trying to focus on your health, it requires a mental change before a physical change. And I think what some people do is they look at the low calorie or the zero sugar and they kind of go crazy. Well, instead of drinking a liter of Coca-Cola a day, I'll drink a liter of Diet Coca-Cola. That's not what we mean when we say lifestyle changes. Everything in moderation. I personally put 1 packet of stevia in my tea every morning, and I'm not necessarily going to stop doing that. But again, for those who are over consuming, it may be a good idea to cut back.
And it can lead to some health concerns, but could it actually be harmful to our health? I mean, is there still research happening about what's in these, even some of the natural ones?
There is research still ongoing, and so far the latest studies have showed that there is a correlation specifically between one of the sugar alcohols called erythritol and health complications such as hypertension, diabetes, and strokes. So there's a correlation there, meaning you could potentially be at higher risk, but they have not come out and said that there is causation, meaning that this particular artificial sugar causes these diseases.
I have a sweet tooth, and I know lots of people do, and it's nice to find some sugar every now and then. What would be your recommendation for a safe and healthy sugar option?
Well, natural sugar is the worst. Artificial sugars are a little bit better, but naturally occurring sugars are your best bet. So if you have a bit of a sweet tooth, skip the dessert. Maybe have some fruit after dinner in order to curb that craving.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.